Dr. Ginchach. Is this another great day at USF or what? I appreciate the opportunity to be here today with Congresswoman Castor. I will keep it very brief. We just took a tour of the insectary, and folks, I've never been somewhere where you try to grow mosquitoes. My wife has me try to kill mosquitoes, but here's the takeaway. This is one more remarkable thing that's occurring at USF. A handful of research institutions is contributing to a national effort to learn more about Zika, that ultimately we can confront it, contain it, and hopefully one day very soon have a vaccine developed to eradicate the spread of Zika. This should not be a political issue, and it's why you see Kathy and I here together. Unfortunately, we let politics get injected into some silly debates sometimes. This is a perfect example. I assure you, within the Florida delegation, I believe there's consensus developing around the urgency. Perhaps it is too late in recognizing that urgency, but I think as a delegation, we can speak with one voice for the most part in continuing to push Congress to finally get a package over the finish line so that the resources necessary continue to flow to institutions like USF. So thank you for the work you're doing. Thank you for what you're doing today to help continue to educate the Tampa Bay community, the state, but also to engage in the important conversations about ultimately getting to a vaccine that can eradicate the spread of Zika. Thank you all very much.
Well, good morning, everyone. Thank you, President Ginchach, and to all of you for being here today to talk about Zika at our doorstep. I'm really pleased to be here with my colleague, Congressman David Jolly. It has now been 6 months since President Obama requested emergency funding from the Congress to combat Zika. Exactly on Monday, it will be 6 months. It was March, just a month after that, researchers and scientists and Dr. Anthony Fauci from NIH and Dr. Tom Frieden from CDC came before my congressional committee to express a sense of urgency for the Congress to act, to get the monies appropriated to develop vaccines and diagnostic tools and provide our local communities with the tools they need. So I'm here, unfortunately, to report that the Congress has been derelict in its duties. That's why I'm so grateful to all of you here on the ground, all across the Tampa Bay area. I'm grateful to the University of South Florida and all of the experts. This is the premier university in the state and one of the tops in the country for health innovation. And the Congress has got to act. You cannot do this alone. But I am grateful to all of the efforts on mosquito control. It's almost like we're having to respond to a tropical storm or hurricane. We are renowned in this area for the ability to be prepared and to cooperate and to address those type of emergencies. And your response so far has been equal to that, and I'm grateful for it. But that doesn't take away how important it is for us to continue to explain to policymakers why additional emergency funds are needed. Zika is the first infectious agent identified in 50 years or so that causes birth defects. And we now know that there have been 15 babies born with microcephaly and birth defects in this country. And there are hundreds of pregnant women who are known to be infected with the Zika virus, and they are being tracked right now. The Department of Health and Human Services says that unless they receive supplemental funding, that's going to impact our ability to track the pregnant women, develop the diagnostic tools, and develop the vaccines. And they've given a couple of examples that I want you to have the latest information, because what Secretary Burwell has had to do is raid accounts. NIH has had to raid accounts that address Alzheimer's research, cancer research, heart disease research, Ebola funding, while we still have emerging cases of Ebola in West Africa. So this is a very short-sighted type of response. It's much more cost-effective and efficient if you can put the money into prevention to prevent additional cases of birth defects and microcephaly. But now that the United States is in the height of mosquito season, and we are in the process of developing the Zika vaccine, the need for additional resources is absolutely critical. Without additional funding, our nation's ability to effectively respond to Zika will be impaired. NIH's latest estimates are they will exhaust the $47 million that they received in repurposed funding to combat Zika by the end of this month. Yesterday, the NIH announced it will begin phase 1